So here we come to day one of problem solving these really tight quad muscles. So I'm going to ask Fleur just to lie on her side, and I'm going to show you how to do a femoral nerve release. So that's the main nerve that comes down through from the pelvis and across the front. So as a practitioner, I can assist her. So if you lift this leg up for me, Fleur, and bend your knee. I'm going to hook her leg onto my hip here. I'm going to make sure her knee is directly underneath her hip, and I'm going to make sure her ribs are back. Now, I'm going to gently ease her heel towards her bottom slightly, and then stabilize her hip with one hand and gently ease the leg back with the other until she feels a bit of a stretch. You feel that stretch there?
Yeah.
Good. So as soon as she feels that stretch, I'm going to back off, and then I'm going to say, so when I bring your leg back, Fleur, look down towards your foot, and then as soon as I release, look up to the wall behind you. Good. And then again, drop your chin as I pull back, and look up to the wall behind you, and one more time, dropping down, and look up to the wall behind you. Now, of course, she can do this on her own. So probably what she'd want to do there, though, is bend that bottom leg just to give herself a bit more support. Then she's going to reach back and hold onto her leg. One, yeah. She has to make sure that she's not letting her knee come higher than her hip. So she's going to drop the knee down, and then she's going to pull the leg back slightly as she looks down towards her foot, and then looks back as she releases, and looks down, and releases. Good. And then just relax. And let's get you to lie on your back there, Fleur, and just compare the two sides. How does that feel?
That's looser.
Looser and longer. And I can even see that from here. I know that you wouldn't be able to see it on the camera, but actually that hip is open. There's more space. So let's just come and do that on the other side. You can just flip your back, and you can just again bend your bottom leg in front of you a little. Yep, grab hold of your ankle there, making sure that you're not arching your back, because that's always very tempting when you're doing this for yourself. So just make sure that your ribs are in and that you've got your pelvis tucked slightly. Now, knee is in line with the hip. She's going to slightly pull back, looking down towards her foot, and then she's going to release and look up and behind, and looking down and looking up. And we're just doing 3 to 5 of these. We'll go halfway in between. We'll do one more. So this is just a femoral nerve release. Good. And then just relax and coming onto your back. Okay. So that should feel already quite a bit softer and longer. And as you can see, it doesn't take very long to do.